Here's the thing we didn't talk about is like, I feel like mentally, like, I feel like I should have not coped as well as I did this pregnancy.
Hi guys, and welcome to another episode of the Metabolic podcast. Now today I'm joined by my extra very special guest, Imogen, my wife. Now Imogen is very, very nervous. It's the first time being on camera. She's never been on YouTube or a podcast, so she's very nervous. So please everybody be very, very kind in the comments and she might come back. Now we're also joined by little baby Noah having a feed here. This is just what we do in our house. We've just got to crack on with stuff. We've got 4 kids, as everybody knows. So Noah's also going to be joining us. Hopefully he stays nice and quiet. So thank you, Imogen, for coming on the show and taking time out of your busy schedule, obviously, as we can see. Also, she's trying to study for her exams. So Imogen, maybe if you can give a little bit of background about yourself and why you're on the show today.
Okay. So obviously I'm married to you, and I'm a doctor as well, but not a GP, mum of 4 now. So you've been doing Carnivore for about a year now.
Yep.
And a longer journey with weight loss and nutrition pretty much since we've been together. But at the time I found out I was pregnant, you were starting the Carnivore diet, and as you're sort of the main cook in our household, you were doing most of the food. So we were eating more meat. We're moving more towards meat-based. I think with previous pregnancies, I was eating quite a lot of pasta and rice and carbs and bread, and we were really moving towards more meat-based, but still having kind of vegetables. At least me and the kids were. So then you were kind of trying to sell me on Carnivore diet in pregnancy. And the main selling features I can remember you saying was that you'd have, people tend to deliver early apparently. But also babies tend to be bigger, which was not really selling me at all. And either mainly on the bigger baby. If you're heading for a vaginal delivery, you don't want a baby with a huge head.
Yeah, that's maybe not the best selling point of Carnivore in pregnancy, suggesting that you might have a bigger baby, and the risk then.
Yeah. So I wasn't particularly keen to start with, but then in first trimester, getting quite a lot of nausea and just general like first trimester symptoms. Anybody's not been pregnant first trimester, well, at least for me, it was just not fun. So then kind of you were suggesting maybe try seeing how you go with eating a lot more meat-based. So, I mean, I was a little bit hesitant about doing pure Carnivore. 2 things, really. First of all, we'd had a miscarriage before, so I first went mentally and just a little bit tough, and didn't want to do anything too extreme that might be risky, even though there's I don't think there was not really anything to suggest it would cause miscarriages, but I just was being extra cautious and a little bit scared of trying anything that wasn't the norm. I also tried keto diets before, not during pregnancy. It was a while ago, and that had really messed with my hormones. So I didn't want to do a keto diet and mess with hormones during pregnancy with a history of miscarriages. Just no. So I quite like fruit, and I figured I'd find that quite hard to cut out. So I was mainly eating meat, dairy, and fruit was the kind of main things, but having I don't know if I can't really remember how much vegetables we ate, if any. I mean, it probably was.
In pregnancy?
Yeah.
You pretty much ate 0 the whole pregnancy.
And then the other thing is with my previous pregnancies as baby 4, the first 2 diet was awful. A lot of ice cream and just junk food. But then maybe 3 was slightly better, mainly because I think the older kid was clocking on to when you eat junk, and it just felt like you couldn't get away with as much. but I was still eating a lot of like pasta and rice. And I think because the way I grew up, it was like, oh, it wasn't a meal unless you had a big portion of carbohydrates. So it was eating a lot of rice, pasta and bread. The main difference this pregnancy was, I think, vegetables and cutting out all the carbs as well.
Yeah, I mean, I think that was a big difference. Obviously, fifth pregnancy, and yes, I mean I haven't really spoken about it on the channel before, but yes, we unfortunately have had a miscarriage. And anyone that's been through that before, of course, I mean, you can attest to this more than I can, I suppose. But you know, it affects both parties, and yeah, you get very, very nervous, of course, about anything in subsequent pregnancies, don't you? And so you were a bit concerned about, you know, trying new stuff, but
yeah,
I think you'd seen it obviously with Freya, our third daughter, and we definitely had a better diet. You had more meat, I think, in your diet with her.
Yeah, I did eat better than the first two, but there was room for improvement.
There was room for improvement, yes. So why was it that, you know, I know why, because of course, because I was convincing you to do it, but why was it that you actually decided to go into this, you know, in the pregnancy?
I guess it was just like you just feeling generally run down, really nauseous in the first trimester, and just seeing if, like, you know, it was just, I think the conversation was like, well, why don't we just try it for a week or two, see how you feel. You can stop at any point. Like, there was no pressure really. It was just like, why don't you try it and see if you feel better? And I did feel a lot better. And if I had a day where I ate like some sugar or something, I would know it, because it would feel what I'd feel worse or get a headache or whatever. And if I'd been eating properly, then I would feel much better. So yeah, and it obviously start with, as you go through pregnancies, like different stages feel different ways, and obviously I can only really compare it to like my previous pregnancies. Everybody feels very different. I definitely am lucky in the sense that I have not had morning sickness like other people get, but for me it really improved the nausea through the first trimester, and like within I don't think it was a week or so, it was just felt way better. Especially because, like, in first trimester, you don't want to tell anybody. Well, I didn't want to tell anybody yet, and you're trying to carry on like everything's normal, but you feel rubbish. You're trying to work with 3 kids. You're just like, I don't have time to feel, you know, anything holding me back.
You don't have time to feel rubbish. You got to get on with it.
And then as we went, so then I just carried it on through the pregnancy, and then other things it helped with. So previously, probably by the 20-week mark, I'd get a lot of, like, especially in the second pregnancy, I had a lot of like joint pain, feeling really sore, like, just felt like a lot of effort to move around. You want to stay active during pregnancy. And I don't think, it was just kind of like, okay, fine, I just get on with life as normal. And like, oh, I remembered I was pregnant occasionally. Like, it wasn't really not.
Remembered I was pregnant occasionally.
Well, it's that thing of like, I think when it's early on, it's not like you're not getting kicks, or it's not huge and people aren't commenting all the time. So you're like, you kind of, if you're not actually feeling much ill effects from it, you're just like, just get on and like, oh yeah, that's happening as well.
Yeah, no, absolutely. So, I mean, basically, yeah, you said that, you know, you had a lot of nausea at the start, and you didn't have kind of true hyperemesis like some people get, of course, but you were getting a lot of nausea. I mean, I remember that, and I think I'd said to you, look, why don't you, you know, just try taking out some of these vegetables? You know, it might make you feel better. There is some evidence to support that maybe more meat in the diet. A lot of women do actually get less nauseated in pregnancy. And so I think after a little while, you kind of agreed with me, because you were feeling pretty nauseous, almost to the point where I think you were saying like, I might need medications, which you didn't really want to take.
No.
And so you decided, you know what, like, let's just try it. Let's take out some of that stuff. And I mean, you said a week. I mean, from my perspective, it was probably more like 2-3 days. I was noticing an improvement.
My memory from that time's not that great. Maybe in 2 or 3 days.
All the bad stuff.
It wasn't. I think that's the magical thing about having babies is that your mind, as soon as you have the baby, it like blocks out all the bad parts.
Absolutely. Otherwise, you
Hence why
probably
we're here for number 4.
number 4. Yeah, you'd never go through it again. But yeah, I mean, within I think 2-3 days, I was seeing the difference with you. You were just more energy, like just less nauseated, kind of complaining about things less. So that was definitely, I think, something that I noticed. So you took out vegetables. What else did you take out from the diet that you were eating in previous pregnancies?
Bread. I don't think I had like any bread, like hardly anything bread. And we probably were eating a lot of pasta and rice. Like every meal I probably have had a portion of some kind of carbs in pregnancies, like the first 3. Maybe not so much with Freya, but like definitely the first 2. And like I think that was the other big thing, and vegetables as well. But I was quite keen to I wanted to keep the fruit in because I didn't want to be like I like sweet stuff, and I think that little bit of like fruit with yogurt was like my thing, like every day or so to keep me going. I think I would have struggled with just the meat personally. Like because when you were like, I'm going to do carnivore, I was kind of like, that doesn't sound like it's for me.
No, you were very supportive for me to do
Yeah.
it, but you didn't necessarily want to jump into that yourself.
Yeah. And I think one of the big things is I would miss eating fruit a lot, and then, combined with the not doing so well keto before as well.
Yeah, I mean, I think you don't. I know you're not necessarily in the carnivore world, at least not yet. Or, by proxy, she is, of course, through me. But this would be probably what most people would call like an animal-based, diet, kind of almost like the Paul Saladino approach. Minus the honey, we don't really eat honey in our house, but you were eating basically meat and fruit.
Yeah.
Pretty much like the whole pregnancy.
I mean, like dairy, like milk and yogurt and stuff.
Yeah, dairy as well, milk, yogurt, cheese, and then fruit, pretty much on top. Now, in the interest of fairness, of course, you were taking a multivitamin as well.
Yeah, I mean, honestly, I probably took it like 75-60% of the time because I just didn't remember. And like, because you have to get blood tests and all that stuff. And the main thing they was like on about was like iron. And like my hemoglobin was within normal range every time they checked it. There's never been issues. To be fair, I've never been super anemic before, like having low hemoglobin. But I think so in pregnancy it can drop a little bit more than normal and it'd be acceptable. But I think it was like this time it was like just in the normal range for like non-pregnant people.
Yeah, I think from memory it was very, very, very normal like the whole way through,
Yeah.
which was essentially high normal for pregnancy.
Yeah.
Basically. So yeah, so you found like a lot less nausea, and then you said later in the pregnancy as well, you felt just kind of less pain, like joint pains.
I think third trimester is just generally a bit uncomfortable. You're getting pretty big, but I remember in previous pregnancies just being agony, like driving because of having to use the foot like pedals, like repetitive movements and stuff was just like really sore. And I was doing the same job in third pregnancy, third baby as this one, and so I have to use foot pedals to record some days at work, and that was just like really sore, and caused me a lot of hip pain. I think I had like 1 day or 2 days where I was like, oh, it's painful this time, whereas previously it'd be like pretty much every day that I was at work, I'd be in pain from what I remember.
Yeah, so just to clarify, so this pregnancy that was animal based, you didn't get that pain or as much?
I probably got it. So I was at work up until 36 weeks, and I was just doing normal, like the normal workload that I was doing before, and over the whole pregnancy, I probably had 1 to 2 days where I was like, oh, that's getting a bit much, and it was right at the end, whereas before it was probably from about 24 weeks I was just like sore.
Yeah, I mean, I think obviously, like, I know you very well, of
Yeah.
course. We've been together 10 years. But obviously, viewers, this is the first time they're seeing you. They don't know you before.
Yeah.
I mean, look, Imogen is a very, very practical, very realistic, very stoical woman who, you know, with 4 kids, you kind of just got to get on with stuff. And Imogen does just get on with stuff. She definitely does not sit and moan and whinge. But yeah, definitely, I noticed a big difference in the amount that you were kind of complaining about pain and discomfort in this pregnancy.
I think the other thing is that, like, mentally, I know that if I sit and focus on the pain, it will be worse. So I tend to try and like just pretend it's not happening. And also, I think I kind of with pregnancy, my approach in 3rd trimester is like, this is a normal process. I'm just gonna get on with it and get through it, get to the end. So try and like not focus on it. But I think definitely it was because a couple of times you were like, "Oh, are you actually feeling better, or are you just not like feeling like you just can't complain about it?" Because you were like, you just seem to not be saying or like asking for a massage or saying this is sore or any of that stuff. And I think it was just genuinely, I just felt way better. Because things like muscle cramps, I got those in other pregnancies. I don't think I got a single one this pregnancy. And just feeling a lot better in general. And I was like, the last couple of weeks before I gave birth, I was like out walking like 5K a day when I dropped the door for day, because I was just like, I just wanted to move, and I did felt good enough that I could keep moving that much without it being sore or an issue.
Yeah, I mean, I remember back when, obviously, first pregnancy, we were living in England there, in Leamington, and I remember you going out for walks, you know, it was like snow and cold and frosty, and you're like, oh, for God's sake, I've got to go out for a walk again, like, get this baby out of me, and this one you were just like, yep, I'm going for a walk, see you later, and just like out for like an hour, like you literally were hiking up Mount Cootha, which is like the local kind of mountain here.
I mean, it's Brisbane, so it's not like
yeah, Brisbane's hilly though.
It's hilly, but it's not like high mountains.
Yeah,
like it's
like not Mount Everest, but you know,
it's like
it's a decent hike,
like a 4K trek. It's not. You don't get much altitude here. Like it's hilly, but you don't.
There's quite a few steps and stuff. Well, like you're not climbing Mount Kilimanjaro or Mount Everest or anything, but like it's a decent hike. Like I get a little bit out of breath doing that, and you know, like at one point I was bigger than you would have been when you were pregnant. But
well, that was the joke in the first 2 pregnancies, was like, you've got to be smaller than me by the end of the pregnancy, which kind of tells you how far you've come since then.
That was always the joke, that I kind of had to be, by the end of the pregnancy, I had to be essentially less big. My belly had to be smaller than Imogen's, otherwise it was pretty bad time.
Yeah.
I probably managed that once. Don't know. Whereas this time, I mean, obviously I've just been losing loads of weight on Carnivore. But I mean, look, I want to make it very clear to all the listeners, all the viewers, I did offer massages repeatedly.
Yeah, you're very supportive as a husband. You did.
But they were declined, I think, almost every single time. You just didn't need them.
No.
You just didn't need them, like all these hot baths, like hot showers, everything. Like you just didn't need them this time.
Also, like before, I'd have to like prop myself up in bed in like a certain particular position to be able to sleep comfortably, and like I don't really need that as much this pregnancy. And then the other thing as well, you were like, we're talking about bigger babies before, like, so second pregnancy, getting like extensive obstetric history here. The second pregnancy, our daughter was like small for dates and was measuring small, and thankfully that's not been an issue in any of the other pregnancies, but they also have been, well, the first 2 have been pretty much on the small side when they've been born. And he was measuring like, all the scans was measuring really, really big, like no issues. So that was also the other thing, is like he seemed to be growing well on it. I think, you know, if at any point it would be like he'd not be doing well, I probably would have stopped, but he was doing really well, and it will seem to from you don't really know when you're pregnant how the baby's doing. You just get like a few scans, and let's listen at one point for the heart rate. So you don't know for sure, but they wanted an extra scan because we had a small baby before, so got an extra one. But he seemed to be doing growing really well and way bigger than any of the other kids had been.
Yeah, absolutely. I mean, I made it kind of very, very clear. Imogen made it very, very clear. We had this agreement that, of course, if there was, the slightest issue, we would have gone back to standard, pregnancy diet, basically standard advice. But there wasn't any issues all the way through the pregnancy. It was pretty much absolute textbook pregnancy. Better than textbook, because textbooks you get all these problems, heartburn and reflux and constipation and nausea. And I mean, we haven't spoke about those. I mean, if you're happy to speak about, I speak about poop on this channel.
Constipation. I don't know, other pregnant people, but constipation was the biggest issue in every pregnancy I've had, and I would we were talking about this when we move it, Movicol, Methimazole, all these ones powdery drink things they give you. They just taste wrong. They don't. I really hate taking them, and it didn't really work that well. And it was it was just I was really uncomfortable with stuff, and so this wasn't necessary. I think it kind of fed into the diet because I was probably having a bit more fat with the meat. But then you were saying, why don't you just? It took you some persuasion. I don't like admitting you're right.
That is very true.
But you try coconut oil, and actually that worked really well for me. It took a bit of tinkering to get the right amount, but that kept me going bowel wise, which I've never had in any of the pregnancy. And I think it was if I didn't have the coconut oil, that wouldn't. I think the Carnivore diet alone probably wasn't enough for me. But that was, I think, if you ask me what the worst thing about being pregnant was, I'll probably say constipation.
Yeah, I mean, constipation's been pretty bad for you in all of those pregnancies.
Yeah,
it is something that if you don't mind me saying, you do struggle with quite often. You have before anyway. You, unlike me, I can just eat kind of a super fatty steak and then put fat on top and even more fat on top of that, and I'm pretty good. But you find it taste wise just a bit excess fat, a bit not.
Yeah, I think that's the other thing is when I was pregnant, I also fatty things would just wouldn't make me nauseous, but it's just I find certain textures just difficult to swallow.
Yeah,
that's probably a me thing, being weird, but
well, I think it's a pregnancy thing, maybe anyway.
I don't know.
But then, you were saying, so you kind of supplemented.
Because you were just eat a chunk of butter, just eat butter, and he was I can't do that.
Yeah, I was channeling my inner Bella, steak and butter gal, and just eat butter, come on, just eat butter. And she's like, no, I can't do it. And just cutting off chunks of butter, and she's like, no, I can't do it.
And then the kids were I'll have some.
Yeah, the kids would eat the butter, but now you just put butter in your coffee.
Yeah, I do find that.
And you like it. So you basically supplemented with, it was MCT oil, keto oil, wasn't it?
Yeah.
Rather than just the straight coconut oil, because just taste difference maybe.
Although I did go too much at some points, and that gave me abdo pain, which was kind of freaked me out the first time. I was just
yeah.
I was what is happening? And then I went to the toilet and I was oh, okay, that's
fine. One thing that I really noticed from my perspective was the heartburn.
Oh yeah, that's true.
And the lack
I kind of forgot that was even a thing in pregnancy, because it wasn't a thing this pregnancy.
Yeah, there's probably women out there, listening to this, hopefully, thinking oh my God, my heartburn is just the worst, absolutely terrible. Maybe you can talk a little bit about that.
Yeah, so previous pregnancies, I'd probably have a bottle of Gaviscon with me, at all times, and just literally chugging it. I don't know how many bottles I went through, insane amounts.
A lot.
And I did learn over time, certain foods would make it worse, tomatoes, orange juice. Tomatoes was the main thing. I probably ate a lot of tomato pasta sauces and stuff in previous pregnancies. Whereas we don't have tomatoes this time, really.
Yeah.
And definitely So this time I do get very mild occasional, but like if I had a glass of milk, it'd be gone. That was it. I didn't really. It wasn't really an issue, but other pregnancies it was like a big deal, like
Yeah.
burning pain through my chest, and then
Yeah. I mean, I remember being sent out at like 10 o'clock at night to go to like Tesco in England, like 24-hour shopping, like go buy me Gaviscon, like literally, and I come back with a bottle like this. She's like, that's not enough. Like, go back and buy me the big bowl, and like sending me out and all hours to go and buy Gaviscon and other antacids are available, of course. And this time, yeah, like you didn't have a single drop.
Yeah, I just had milk.
Yeah, like
and
you didn't have a single drop of antacid, like liquid, anything at all this whole pregnancy.
But this time, if I go, I need to just feel like, oh, that's slightly irritating. It's like it was, even though I had it, it was like if I had a glass of milk, it would probably pretty completely go. So, it's nicer to not have it than to have it. But if we're out or somewhere, I'm just like, oh, that's slightly annoying. But it's not really, oh, I urgently need something for this right now.
Yeah. So, I mean, benefits wise, we've covered a few things. I mean, constipation, that was a big issue for you. It is a big issue for you. That just was almost a non-issue during pregnancy.
Yeah. When I forgot to take it, though, it was an issue. But
yeah.
You could
just supplementing with the fat, you finally listened to me to take out the fiber and put in the fat, and it worked.
Yeah.
Your heartburn was massively better, almost to the point where it didn't even exist that much.
Well, I forgot about it.
Yeah, you forgot about it. And then just a lot less pain, a lot less discomfort, just more energy, like you said, able to just go and hike up Mount Gunther without effort almost. I mean, well, from my perspective, you just, I'm off, bye, see you later, came back, and you looked like you could go again if you wanted to, quite easily. And a lot less nausea, early on as well. Were there any problems? Were there any downsides of eating a lot more meat in pregnancy, taking out those vegetables, taking out the carbs and the wheat and all the other things we're told to eat in pregnancy? I guess that says it all.
I can't remember any. I mean, not really. I don't think there wasn't anything that I had this time around that I didn't have before.
Yeah, I think at one point you did get maybe a very slight meat aversion. I think, if I recall, you were like, oh, I don't know if I can eat more meat today. And then I think I just said, well, maybe just don't eat. And then you just basically didn't eat. And then the next day you were fine again. Was that when you were
doing that like 30-day
ribeye?
And I was just like,
I don't know, maybe. I can't remember.
I don't know.
But then you weren't doing it with me, so
no, but we were eating a lot of the same meal over and over and over. I don't know.
We were, to be fair. Well, maybe that's a good segue then into what did you actually kind of eat in pregnancy?
Well, basically what you cooked me.
What I cooked you, yeah, pretty much.
So breakfast, maybe like, I can't really remember if we were having the same sort of thing now, but maybe eggs, bacon, maybe some mince, whatever meat we could basically had just left over in the fridge. It was quick. Lunches I'd usually have like olives, a lot of silver side, like cold meat, cut meats. I might have a couple of crackers as well. Usually it'd be like, while I'm packing the kids for lunch, I'll just shove an extra portion in for me. But it was mainly like cold cuts of meat, olives, cheese. Well, that's the bad thing in pregnancy, is you like have to eat like certain types of cheese. You can't eat the good cheese.
Yeah, you can't really kind of eat a lot of soft cheeses and
no, which is
camemberts and bries and stuff like that, which is all the nice stuff.
Yeah. Yeah, and so it was just mainly cheese, olives, cold cuts of meat for lunch. I'd probably taken a couple of slices of fruit just because I like eating fruit.
Yeah, and then just steak, basically.
And then the evenings, we'd probably have steak or some kind of cut of meat, basically. And then that was about it. And then I guess the main things we eat in our house are like pork crackling crisps, because that's sort of we just have like the staples we feed the kids. So we'll just eat the same. So like pork crackling crisps, avocados, although they were probably out of season for us.
Yeah, I mean, they're like pretty cheap and in season now, I think. But
yeah,
I don't remember you eating that much avocado. You just ate like a lot of steak.
Basically. I had a lot of like
Mm.
in the evenings I'd have frozen berries and yogurt, or frozen mango and yogurt. And that was pretty much it. Exciting stuff.
Yeah, I mean, that's the thing though. I don't think you need to be super exciting, super creative on like a carnivore animal based diet. You know, it's just eat what tastes right, eat what tastes good.
Yeah. And I think, I think the other thing as well that made it a lot easier was is investing in an air fryer. Like if we didn't have an air fryer that made it like super easy to cook all the meat and stuff, probably would be, especially with the kids, you can just the ease of shoving it in, take timer off and going, because our oven is god awful in this
rental.
Yeah. So
the oven's terrible.
Having an easy, convenient way to cook what you want to eat definitely helps massively with trying to when eat better as well.
When you got 4 kids, it makes a big difference. The air fryer is definitely was one of our better buys, wasn't it?
Yeah, but I think if I was having to like fry up eggs, bacon in the morning and not be able to go off and do other stuff and keep watching a pan of stuff, I don't know if I'd have eaten quite as well. But yeah, that was the main things that we ate. I think
that's an important point though, because a lot of people out there, they're going to be watching this, listening to this, going, these guys have like 4 kids. Like they both work full time. Like how are they even managing it? I mean, things like air fryers and stuff. Like nobody has time to come home like 5, 6 p.m. whatever after work. Kids are screaming they want food. Like this is why people turn to fast food, go and get McDonald's on the way home, KFC, whatever, because they don't have like hours to cook some amazing creation. And
toddlers don't understand. It'll be ready in 5 minutes. It's just I want it now. I'm hungry now.
Yeah, when they want it, they want it. They don't understand. But I'm making you some amazing, delicious, nutritious creation that's going to look like this picture. And they're like, I don't give a damn. Give me the food.
Yeah.
Basically. So yeah, time saving in our house is definitely important. You mentioned some blood tests earlier. Like you mentioned your iron. I mean, were there any other issues in your blood tests? Like at any point in the pregnancy, was any concern raised about your health, baby's health, like Noah's health, anything at all?
So because I've had pretty low risk pregnancies, all in all, apart from like small baby before. So the way it works in Australia is that you can either go public or private. And if you go, we went public because I just wanted like a midwife-led birth at the hospital, and it was managed through the midwives and the GPs. And so with that, you get like basically here you get like a couple of, you only get your bloods checked, I think at the beginning, I think they did it like 20, 24 weeks, and then at the end, and you get scans to like one to at the beginning to say where you are in your pregnancy, so they know to like when to book you in, and then you get we got an extra one with the screening, and then one at 20 weeks, and then they wanted just an extra one at 28 weeks. So I didn't have a lot of monitoring. Like if you go private here, I think you get scans like every appointment you go to, from what other people have told me. So we didn't maybe have super high levels of monitoring, but that was kind of a choice based on past experience and a lot of other things. But basically at every point the bloods were like plumb normal. The scans were all within normal limits, no issues raised at all. So yeah, there was nothing at any point that they were like, that's abnormal. I mean, I did, to be in all fairness though, when the midwives talked about nutrition, I mean, it's very, very vague anyway. They're just like, eat healthy was pretty much the summary. Especially because they're like, oh, you've had a baby before, you know it all, it's fine. I don't need to cover all this. So, they more focus on like, these are the things you shouldn't eat in pregnancy. Don't eat like all these things that might have listeria in them. Don't eat like raw meat, which that was the only really bad side about doing carnivore when or more meat based while you're pregnant is that I really like a rare steak, and you can do that.
Yeah, I mean, you didn't have it like super well done, but we kind of followed like CDC guidance. You can heat it, I think, to like 64 degrees C,
Yeah.
which is like a medium rare, maybe. Like mince, it needs to be 68
But then when you're
degrees.
like
And
feeding the kids carpaccio and like eating a rare
yeah,
steak opposite me, it's just like
sorry.
looking longingly across the table, just trying to like smell.
Yeah. Well, to be fair, like I'm doing like 30 days of mince now, and like I'm looking at your steaks longingly.
Yeah, that's true.
The smell wafting over to me, thinking, "Oh God, I really want to eat that." Um, where, like, obviously Noah's been born now. The pregnancy went perfectly fine. Like
Yeah.
delivery, like, what was there any issues in delivery at all from your experience? Was there any difference to previous pregnancies?
I mean, so I think overall with our deliveries, I've been, I don't know, lucky, but like first pregnancy stumbled across for this pregnancy yoga class, and I think the teacher in that mentally helped me prepare a lot for the birth and like how you look at pain, and it's being a actually positive thing during labor because it's getting you more towards having your baby, and that set me up for a really good delivery with our first one, Lily, and that kind of has carried through. So I have had in every pregnancy, a vaginal delivery that's been minimal medication. So I've, I think some of that is luck because I do have fast-ish deliveries, and I've kind of learned stuff about how to kind of manage myself through it. But this time around, I was hoping it would start off sooner, but it didn't. But
Yeah, I think I'd like convinced you it was going to be
yeah,
some like super quick delivery with the carnivore, and it
no, it was
didn't
more
quite
like
happen.
I was hoping it would happen at like 37 or 38 weeks and just get this baby out of me, because we get to the end, you're just like, I having to pee every 20 minutes. I can't see my
Yeah.
toes anymore. It's just huge, and there's this like tiny human being doing a Mexican wave in my abdomen every hour or so. Like you just, well, for me at least, and I think a lot
Yeah.
of people I've talked to have just been like, you just want it over by that point.
I think that's what I was trying to convince you. Like, it wasn't because like, Noah's going to be really big and this is a good thing. It was like, he's going to come out earlier. He's going to grow quicker.
Yeah.
He'll come out earlier. Like a lot of people say that he actually just came out when he was meant to come out.
Yeah.
But yeah.
But delivery wise, I mean, I think it actually went slower than previous ones, but I think it was more to do with like positions that I didn't feel like I could tolerate standing up as well this pregnancy because he was just right down in there. But it kind of went, I think, as smoothly as other times. I had a little bit of gas and air like at the end. I don't know if I needed actually less pain relief than I did with Freya. I don't really.
I think
I think labour, my mind just kind of like blocks it out, and you're like, oh yeah, I started, and then I remember the baby coming out. Like, my mind just kind of.
Pretty much, yeah.
You probably can remember this more clearly than I
can. Better than you can, yeah. I mean, I think in like with Lily, if you are first, you had like 2 paracetamol, and that was it. You threw them up like an hour after you had them, and then that was it.
This wasn't necessarily out of choice though, because we got into hospital and they were like, "Oh, you'll be ages," and then she came out. So
yeah, that was a pretty quick
really...
one. And then like Charlotte, you were induced, so that was a different story altogether. And then Freya and like Noah, you had pretty much like 1 paracetamol, maybe.
Yeah,
that was it. So, and then gas and air. So, obviously, like now you're breastfeeding. I mean, we can see that, of course. I mean, have you had any issues with milk supply, milk coming in? I mean, this is something so many women struggle with. Have you had any issues with your milk supply at all?
No,
none at all.
No, I mean, I guess it's that thing of just knowing that having done it before, like I can do this, and you just kind of have to ride it out a little bit in the first weeks while your supply comes up. But I felt like it came in actually pretty quick.
Hmm.
And I feel like it's also been a lot less uncomfortable feeding this time. I don't know.
Hmm.
Like, first time around, I remember it being super sore, loads of like nipple pain. I'm using like creams and stuff, just trying to like get through the first few weeks. Whereas, like, to be fair, I think with Freya as well, it wasn't really a thing. So I don't know if it's more because I was eating probably more meat based with her, but I was still having carbs. It was kind
Yeah.
of like a transition between the first
Yeah,
couple and now.
I think so. With Freya, it was more like you were definitely eating more meat for sure. We were
Yeah.
more conscious of diet, I think, at that point. But
Yeah.
with Noah, it was pretty much just animal based meat and fruit, pretty much, and dairy, of course. One thing I want to ask you, actually, I mean, I know the answer to this, of course, but what did you find like any issues with things like your hair during pregnancy this time versus previous pregnancies?
Uh,
Like hair falling out?
I think usually in pregnancy it'd be like it wouldn't fall out, but then after I gave birth, then it'd start falling out loads. What I don't feel like. I mean, you probably drives you crazy being like in a house full of 4 women with hair everywhere
Yeah.
coming out. Like my hair does tend to, I guess, molt a little bit. Like I probably shed more hair than most people.
Yeah, do you know what? That's actually really interesting. The reason I'm asking this is I know the answer. Is basically like you haven't had like any issues with your hair
No.
at
And the
all.
other thing I forgot to say earlier as well is that in previous pregnancies, I would get bleeding gums.
That is true.
For the last 10, 12 weeks, like quite a lot. And I'd be brushing and they give me, what's that stuff? Give me some mouthwash. I can't remember which one is.
Chlorhexidine, whatever.
Yeah.
Mouthwash and
Then just to be
cortisol,
like, oh, it's just pregnancy related gum inflammation. It's fine. But just need to keep brushing and scrubbing. Whereas I think I had it like once or twice in the last 2 weeks this time.
Yeah.
I was like, this is weird. Why is this not happening?
Yeah, I mean, like in all the previous pregnancies, I want to come back to your hair, but yeah, like you've had bleeding gums, like that is pretty common in pregnancy. And I talk to a lot of my my patients about this kind of stuff. Like I mentioned it on the channel a few times. We kind of just in the medical profession we've just normalized so much pathology.
Yeah,
because it's just so common that it's just seen as a normal thing. But like bleeding gums, like that isn't actually necessarily normal in pregnancy, and it's very common, but it's not normal. But you didn't really get that much this time at all.
no, like hardly any. I was like, I remember saying to you, this is really odd. Like because I remember I got a bit and I was like, oh, this is like the first time, and I'm at like I think I was in like 30
that's meant to
weeks
happen.
or something. I was like, oh, that didn't happen.
Yeah, like I'm meant to actually get my
mentally blocking out all the bad things, but like
I mean, there's going to be people out there listening to this going, oh yeah, but she ate loads of fruit, so she got loads of vitamin C. But I don't think you ate any much more fruit than you had in previous pregnancies.
Oh, I probably ate way more in previous pregnancies.
Yeah, you probably ate more in previous pregnancies than this one.
Yeah.
And you weren't eating like liver and organs and stuff like that in this pregnancy at all, were you?
No.
So like liver's not really recommended in pregnancy, just in case for vitamin A. So yeah. And you're not a fan of offal organs anyway.
We were mainly eating like mince, sausages, steak, like more mainstream
just
forms of meat.
mainstream meat. Like I want to come back to your hair a little bit though, because yes, look, I'm in a household with 4 women. There is a lot of hair, a lot of hairbrushes always go missing. It doesn't really bother me. I think it bothers the vacuum hoover, the vacuum cleaner quite a lot. But I've noticed like previous pregnancies, you have lost, hair's certainly shed fair bit, and afterwards like breastfeeding and so on, like you've lost quite a bit of hair, not like balding but just molting quite a lot. And you've had this issue like as far as I know you've always kind of lost quite a bit of hair. But I mean, I commented this morning, I think it was you know, that like your hair's just like super thick. And I don't even recall the last time I saw one of your hairs like on the floor like on me.
Oh,
I'm usually
it's still
covered.
happening.
I'm usually covered in your hair.
It's still happening.
Is it? Fair enough. Fair
Just
enough.
not as many.
Yeah, I just like in the shower and stuff. I
Yeah.
don't think it's happening as much on this animal based
It
diet.
does seem to be a bit less.
Yeah, I think it
I would
is.
say that. Yeah.
I think it is. So I mean, you were talking about the midwife and like the doctor. We didn't have an obstetrician really because we were just going through the public system. But
Yeah.
did you tell anyone that you were doing like this animal based pregnancy, whatever?
No.
Why not? Why didn't you tell anyone?
Because having worked in the medical profession, and been through med school where what they teach about diet and nutrition is, I don't know. Did we even get any, like, I don't even, you went to the same med school, but not the same year. So I don't even remember being actually taught about nutrition. It just being like,
yeah, no.
It, like, a caveat to most conditions is like, good, diet can help.
Yeah.
And it's like, okay. And then the only other teaching was at school, where it's like the food pyramid and like 442. And so, and then obviously living with you, and you like, I've, hands up, not done any research. I just trust you. And
for better or for worse, that's what they say in wedding vows, isn't it?
Yeah. But I know you, and I know that you're very meticulous, and you will research everything very thoroughly, and you will, like, I'm like, if you've read this, you're going to read it when we're depths, and I'm going to read it at. So if you're telling me this is the summary, I trust you. So, like, I guess through your health journey, like, I've therefore been educated as well on nutrition, and essentially what I was taught at school and med school is just not very great. But then that also gives you the perspective that when you're dealing with like health professionals, that they're probably coming from the perspective of traditional teaching and 442, and this is what makes a healthy diet, and that you just kind of accept that you don't agree with them, and there's no point discussing it, basically.
Yeah, I mean, I think it is kind of sad that, you almost have to hide it from.
Yeah, I also just get a bit twitchy when it's like, when you're talking about it in relation to your children as well, you just don't, I just
yeah, people are weird.
People are weird. I don't want to get a tirade or someone who just feels like they need to. Pregnancy seems to bring a lot of unwanted advice, and I just think I want to minimize that. So I don't want to listen to a 20-minute spiel from someone about dietary advice that's completely wrong, basically.
Yeah, pretty much. I mean, yeah, obviously, like, you do trust me, and of course I'd never lead you astray. And yeah, like, I'd probably drive you crazy. Like, when we're buying like anything, I'm just like researching it for weeks, and yeah, like, so,
that's assuming that you assume that I'm actually listening to what you're saying.
Well, yeah, that's probably a lot of time you don't, but that's fine. That's fine.
Just listen to the salient points.
But I think that's kind of like the power of like meat in a way, though. Like, obviously, look, you're living with you are a doctor, of course, yourself. You're living with a doctor, and people are going to say, "Oh, yeah, but she's got this person to guide her." But I'm not really talking to you day in, day out about like, oh, this is what this is in this nutrition, this is what's in that nutrition. Like, I'm not putting together like this super nutritiously balanced diet for you and like laying it all out. I'm just like, what do you want to eat tonight?
Yeah.
And you're like, yeah, steak sounds great. Like, yeah, mint sounds fine. Burger sounds fine. Like, we're not talking like all this in-depth nutrition at home, really.
No.
Nobody's
got time for that.
No, nobody's got time for that. It's just like, yeah, what do we feel like for dinner tonight?
Yeah.
And it's just, I think that's just the power of
I think the conversation was basically like, okay, so you're going to do a pure carnivore diet. I'm going to eat what you're eating, but I'm also going to add in fruit. Was like, that was the extent of the depth of the conversation, really. And then you'd tell me things of like, oh, I read this paper that said this is interesting. Like, you'd tell me things that you found interesting. And you still do, like, if, oh, I read this book, this is interesting, or what,
Yeah, and then you probably like rolled your eyes or something and like, yeah, okay, great, thanks.
But so, you know.
Yeah. I guess that's maybe a good segue into like where, like what are you eating now, breastfeeding, and where do you go from here? Like what's your plans for diet? Do you have any plans for diet? Are you just whatever? Like, where are you at now?
So at the moment, breastfeeding, well, my initial intent with breastfeeding was like, I'm just going to eat what I want because I'm like sleep deprived. I'm just going to eat what I want. But that's been a lot of what I've eaten during breastfeeding has been dictated by how Noah's been doing. So he, so I, the first week or so was fine. Then we had probably flu in the house. Our second eldest was like super sick.
Yeah.
With a 1 week old baby at home, just what you want. Home over the school holidays.
Yeah.
Anyway, and then he got a bit snuffly, but seemed to be fine. I guess breastfeeding, getting, we've been all vaccinated and stuff before. But he then seemed to be getting rashes like over his face, over his body. He was pooping like every couple of hours, really runny. It was just, and he just seemed really unsettled with like gas and stuff. So, because you were at work, I was at home more, so you kind of were like, okay, like seeing it more from an outside perspective, whereas I was just like, I'm only sleeping like an hour at a time. I need to just like getting through this. It'll get better. Just like clinging on to like, it will get better at some point. And you were like, oh, maybe he's actually got a cow's milk protein intolerance or some kind of intolerance is going on. So you were like, maybe if you just do a pure carnivore diet and really like see how you go. So to start with, I cut out all dairy, which like I like dairy. I like a bit of yogurt.
Yeah, you do like dairy.
That like wasn't happy about that. But you know what? I needed to sleep more than I needed to eat some yogurt.
Fair enough.
So we cut out cow's milk, and I was eating mainly just meat. And then my mum came to visit, and they like a good pastry and carbs. And I probably started then eating a lot of
diet went a little bit slightly downhill, I think.
I started eating a lot of wheat, and there was probably soy as well and stuff they were buying. And then it got worse. He seemed to get better and then worse again. So then I cut out wheat. So it was basically like all I could eat was meat and eggs.
Yeah.
Was basically all I ate for a couple of weeks, and it seemed to completely resolve. And then we've just slowly added stuff back in. So now I'm eating dairy again, meat, avocados, fruit, and then occasionally a bit of like treat stuff with the kids. Like went to birthday party today and I had some cake, but like we're not.
That's a kid's birthday party.
Routinely, every meal eating. It's like every now and then, or I've had a terrible night's sleep. I'm gonna treat myself.
But do you miss any of that? Like junk food, that bad food, or anything? I mean, because like previously, I remember like previous pregnancies and stuff, you sending me out like 3 a.m. to get ice cream.
We ate a lot of Ben and Jerry's, I think, in the first.
Yeah, we pretty much just like supported Ben and Jerry's stock, like.
And you're like sympathy pregnancy.
I was like, well, if you're going to eat it, I'll eat it as well. Yeah. Hence why I probably got bigger than I should in your pregnancies. But like I remember you do have a sweet tooth, and you do like chocolate, and you like ice cream and stuff like that.
I do. I will admit to that.
You definitely do. Like, where do you miss that? Because you don't really eat that now, like much at all.
Well, I do treat myself like occasionally. I'm not like.
No, you're not a nun. Like, yes, there's some stuff in there, yes.
But I've cut down a hell of a lot from what I would have eaten. And I guess it's that thing of also having the knowledge of like, I think things like raisin toast or stuff that they like is kind of branded as like, you can kind of convince yourself it's like, oh, it's got raisins in and it's a bread. It's not a dessert. It's not super unhealthy. And you're like, actually, like, it's just the more the knowledge of, okay, if I'm going to eat these things, it is a treat. It's full of sugar. It's a sweet thing. It's not, you can't just like eat it every day for breakfast and convince yourself it's healthy. I think
Yeah.
it's more that knowledge of not knowing you can't eat that stuff all the time. Like if you want to treat yourself occasionally, that's okay. But
Yeah.
I think
Yeah.
that's more it's more kind of an education
Yeah.
on it, basically.
And you're like just cool with, well, you know what, like, yeah, I know this is bad for me, but every once in a while, like, I will accept that. That's
Yeah.
fine. But you're not kind of convincing yourself, oh, it's good because it's got raisins and it's breakfast and it's got
Yeah.
fruit. It's good. It must
Well,
be
I
good.
was
You
raised
know?
in a house where like we'd eat muffins and pan of chocolate as like a good breakfast. So
Yeah. I mean, to be fair, like you turned out pretty good. So, you know,
I think
let's not blame your parents too much if they're listening. We love you.
yeah. But I think it's been proven time and time again. Like I think I've got a pretty good metabolism, so I can get away with eating stuff, which is probably not the best though, because then you don't get the bad effects from it. But at the moment, I'm kind of eating mainly meat, mainly fruit, dairy. I think kind of going forward to what you were saying before. So I've got, you kind of mentioned at the beginning, but I've got exams coming up in May, which are like super hard. So it's like postgraduate exams for like the specialty I'm doing. So I'm like, anything that might help me do better in those. I'm like, maybe if I actually did a more strict diet, maybe it would help because you were saying like, again, I do listen to some of the stuff you say, like brain function memory and, can help us like, well, maybe give it a go. Like it's probably not gonna make me perform worse. Like I don't see how it's gonna hurt. If I can actually, but kind of, I think that's the next thing, to maybe transition and just see how I go. But I probably will struggle to like give up fruit completely.
Yeah. I mean, basically, I guess baby Noah seems to be pretty compliant at the moment, behaving. So we were going to try and split this episode into two, just with Noah and everything, but he seems to be behaving pretty well. So maybe we'll just kind of carry on for a little bit.
Kids, you got to go with the flow.
You do just have to go with the flow, absolutely. One thing that you've commented on to me, privately, but I think you're okay to talk about it, is weight. Now, you've never really struggled with your weight. I mean, you're talking about your weight anyway, your metabolism. You've never struggled with your weight at all.
Well, no, but
not really.
But also, like, no, I'm not being like overweight, by any stretch. Like, I've always been like the healthy BMI range, but then again, like, is BMI the best measure?
No,
that's
not.
another conversation for another day. But I think at points I've definitely put on more weight, and we've gone through. I mean, I talk about like but like essentially we end up eating the same thing. And if one of us is like,
oh, I get way fatter than you get.
Yeah, but
my metabolism's terrible.
Like, you like anybody, you go through cycles of like eating worse, putting on a bit more weight, probably being a bit more overweight than you should be, and kind of going through cycles with it. But
yeah, I mean, one thing that you said to me, the other day was you feel like you're kind of losing the baby weight, I think, quicker this time around than you have previously. And bearing in mind, this is fourth baby as well.
Yeah. So
fifth pregnancy, fourth baby. Like you would expect it to be harder.
I mean, the first baby was like 25. So I didn't really have to try because whereas like third time around, I definitely felt like it just was a little taking longer to get back. Whereas this time it just seems to, I'm not, because I was kind of like in my head was like, okay, well, I'll just give myself a couple of months like before I start worrying about really being super strict with the diet. Let's just get through newborn phase. Like mentally, I'm like, you can't be too tough on yourself. Like if you will, you've got to be like reasonable. If you're getting 4 hours sleep and it's trying to like get all the kids to school and functioning on low levels of sleep and stuff, you can't also be like beating yourself up for, not eating too much or being not following a strict diet or whatever. It's like going to give myself a couple of months to see how it goes. And actually, I've just gained like every now and then just keeping track of my weight just to see if it's tracking back down. It was mainly, I don't really like weighing myself because I don't feel like it's the best thing, but it was more like if I suddenly started putting piling weight back on, it'd be like, okay, right, you've gone too far. You need to, maybe really think more twice about the diet. So it was more tracking it just to make sure that I wasn't going the wrong way. But it seems to have been dropping way quicker than I was kind of expecting. Like I probably put about 15 kilos over the course of pregnancy. Obviously, some of that's baby, placenta, and you drop quite a bit just with giving birth.
Yeah.
But it's probably gone down by like 10, 11. I'm probably within like 2 kilos of what I was pre-pregnancy.
Yeah, I think it's gone down a lot quicker than it has in previous pregnancies, and certainly you have commented on that a number of times.
Yeah, and it's also just nice to be able to fit back in your old clothes again sooner.
Yeah, it is, certainly is. Unless apart from when you're like having to buy like a new wardrobe every like 3 months, like I have.
Yeah, well,
you're always on at me like, you're bloody spending money again on clothes.
He's like, I'm going to buy really good clothes that'll last me for ages, and it's like I'll just spend on quality, and then 2 years later he's like, oh, they don't fit me anymore. So
yeah.
Anyway.
Although to be fair, like I'm wearing clothes now, but like I put on 2 shirts the other day that I haven't worn in like 15 years, 20 years. One of them's 20 years old. Like I've worn it. I don't think I've ever worn it in public because it just never actually fitted. Like why I even bought it, I don't know. Maybe it was a present from my mum or something. But like that's kind of where I'm at now with my journey. But this episode's really about you. Is there anything, because I don't know how long we've been talking now, maybe almost an hour. Is there anything that you like haven't kind of said that you think is really important to mention, or any kind of words of wisdom for maybe other women out there either trying to get pregnant, maybe struggling, or in pregnancy having nausea, all these things that we've talked about? Is there anything that you want to say maybe to them?
I guess the thing we didn't talk about is like I feel like mentally, like I feel like I should have not coped as well as I did this pregnancy, because I was functioning on like an hour's sleep at some point postpartum, and then we've got 2 kids at school. You got to get them, like the logistics of getting them there and all that. Like I feel like, and then financially everybody's struggling at the moment with all the rate rises and stuff. So you've got it going on with like I'm on maternity leave and I'm not getting paid. Plus we're building a house. So there's a lot going on. And this is spoke before, and that's probably just like touching the surface. So I was kind of expecting to struggle a bit mentally after this one. I was like, if I'm going to get postpartum after any pregnancy, like it's going to be this one. And actually, I just felt like I didn't really feel low. Like there's certain points where I was like, I am so ridiculously tired, I'm just going to start crying. But that was like, I get sleep and I feel absolutely fine again. But like I was actually shocked that I didn't feel more down.
Yeah, I mean, I've noticed that, definitely. I mean, I hope you don't mind me saying, like, you don't have a history of anxiety or anything diagnosed, but you do get more stressed than I do, I think.
Oh yeah, for sure.
And definitely, like, yeah, I mean, like we're building a house, so I started a new job like a year ago. We like new baby, interest rate rises, like our mortgage has gone up like $60,000 a year or something. Like
it's gone up like 50% or something.
Literally doubled. Like it's insane. 50 is doubled. Like, that is a lot to make anyone stress.
Yeah, and I think in the background of like, I feel like I felt a little bit guilty about like, oh, okay, I'm just gonna go off work now for like, it's just gonna not work for a while now and like not get paid for like 4 or 5 months while this is all going on. That was like the financial, I was big stress at the moment, and I stress more than you about stuff. I get like fixated and really stressy about things. So I thought I was expecting to struggle a bit, but I've surprised myself, and I don't know if that's the meat or maybe because I didn't have that much stress in other pregnancies, but
but then we went trying to build a house, and it wasn't the interest rate rises and fourth baby and all the rest of it. So I remember when I was early on in Carnivore and we were designing the house, and I remember having an argument because you just thought I didn't care because I wasn't super stressed about the house, and you were just like, you don't care, like you're not even reacting. And I was like, I do care. I'm just like, it's just, I'm not stressed about it. Like, it'll be fine. And then you're kind of like that now. You're like, like whatever, water off a duck's back. Like, it'll be fine. We'll work it out.
Yeah.
Which is kind of like, that's
I still stress a bit, but not anywhere near as bad as before.
Not as much. Yeah. No, for sure. I mean, any other words for maybe women out there who are wondering about doing an animal-based, kind of pregnancy?
I mean, for me, it worked really well. Definitely felt a lot better. But I guess it's like the thing with pregnancy is it's so. It depends on like your circumstances and what your pregnancy is like and what care and stuff you're going to be needing and stuff. But the thing is, I don't think you need like vegetables for a healthy diet. Basically, is my takeaway from it.
Yeah, I mean, I think
I just go with what feels right for you. Like if it feels good and you're feeling good on it and it's working, just go with it. I mean, obviously, like junk food tastes good, but like with it being sensible with it. But
so I think the key thing here, obviously, look, officially Carnivore diet is not recommended in pregnancy. I have to say that. I apologize to viewers and listeners if you can hear our number 2 child has woken up. She's unwell. She's just about started crying, so we're gonna wrap this up pretty quickly now. But yeah, like officially, Carnivore diet is not recommended during pregnancy. I'd always recommend people go and speak to their doctor, their GP, their obstetrician, their midwife about that. And if they're having any issues, they definitely need to go and see someone. But otherwise, I think you're right. Like, we don't necessarily need those vegetables. We certainly don't need all of the junk food. We don't need the wheat, the bread, the pasta, like all this empty stuff, in the pregnancy. And I certainly see it all the time that people just don't eat enough meat, full stop. But especially women in pregnancy just don't eat enough meat.
Yeah.
And
I think if your iron is low, that's going to make you feel like 100 times worse. So just even from getting your iron levels up from a eating meat perspective, like even if you're not going like pure carnivore, that's probably going to help if you just increase how much meat you're having.
Absolutely, yeah. I mean, the things like oxalates, I know you're not massively into the research, in anti-nutrients, oxalates, things like that. I just know what you told me. You know what I've told you. But certainly that's my interpretation, I think, of why things like nausea, why your nausea went away when you stopped eating the vegetables, was actually things like the wheat products, the lectins, the oxalates, the poisons. In my mind, it makes sense if you're basically ingesting poison, essentially, when you're pregnant, and you're in that kind of early first trimester, this really rapid kind of growth phase, where we know anything that's teratogenic is super dangerous in that first trimester. That's the most dangerous period. It actually makes sense that you get incredibly nauseated and your body's telling you don't eat.
Yeah, well, even from previous pregnancies, like, certain vegetables and would make you, fruits, but mainly vegetables, like if you eat them, like it makes you more nauseous and feel worse. I kind of noticed that. And it was never like meat or dairy. Like dairy definitely helped massively with that. So like even before you even know it, you kind of know it. Like if you listen to your body, essentially.
Yeah, I think when you kind of look back, you do just kind of know it. Anyway, I think that's probably maybe a good time to wrap up unless
Yeah.
there's anything else you want to
No,
add.
I think it's at bedtime.
We've been going for about an hour now. It's definitely all of our bedtimes. Noah's smiling away at the thought of going to bed as well. He's been super good today. Thank you very much, Noah. Anyone that's listening on in their cars or anything, well, he would say hi, but he's not talking, so he's only 2 months old. Anyway, thank you very much, Imogen, for coming on today's show. I really do appreciate it because I know you are incredibly busy right now, mum of 4, as we know, studying for exams and even to the point of breastfeeding on the show. So amazing woman here, everybody. Thank you so much for coming on the show.
Mm-hmm.
And thank you guys for tuning into this episode of the Meat Medic podcast. Let me know in the comments down below. Please, everyone, let Imogen know how well she's done. I think she's been absolutely great today on today's show. She was incredibly nervous about coming on. I think she's been amazing today. So thank you, Imogen, for coming on. We'll see you guys in the next episode.